Our next guest has a lot of problems with what the insurers are saying right now.
Democratic Representative Joe Sestak from Pennsylvania is here, and I got to say, this is one of those guys in Congress. You love him even if you disagree with him. So it's a pleasure to have you back on, Congressman. Thanks for being here.
Thanks,
let me talk about the Baucus Bill first, because Senate and Congress are going to have to reconcile their bills. Doesn't the Baucus Bill have a tax on middle-class health plans, and isn't that one reason why a lot of people in Congress are against it?
Yes, the concern with the Baucus Bill is that it's taxing these employer-based health care plans via the insurance company. The real issue, though, is that it's tied to inflation having to do with the consumer price index rather than the health index, which is much greater. So eventually it's going to bring in not just the more wealthy health care plans, but it's going to bring in middle-class average America. You know, when I listened to this discussion just before that, the issue really comes down to this. The health insurance companies want 40 million American customers by a better subsidy system and a stronger mandate than the Baucus Bill has, not dissimilar to what the House does have. But what they don't want to have is a fair competition, because 94% of all health insurance markets across America, David, according to the Department of Justice, are in a non-competitive market. That is, they're almost monopolistic or cartel dictated by the insurance companies. That's why Liz's point is so important. We actually need a public option out there to get back to competitive pricing.
Representative, I look at what's all before us, and we wonder specifically how this is ever going to get passed, and especially when you still aren't able to take your insurance across state lines if, for example, you get laid off, and the tort reform issue is not also front and center. Why are those things not being pushed a little more forcefully in any plan that comes out through the Democrats?
Of interest, Liz, you bring up a great point about breaking down barriers among the states. The actual health insurance exchange that the House bill has in it, that every insurance company can put a plan in there, as well as the public option. Those are nationwide plans. They actually spread the risk in a national pool. You actually achieve what you just spoke about by spreading the risk in national pools. It's a different way of achieving what you spoke about. Now, you could explore that option of breaking down barriers among the states. But if you do that, you need a national level of benefits, because otherwise every insurance company will head to a state like Alabama, where they don't have certain minimum benefits mandated. And in fact, 9 states forbid any appeal if your insurance company differs and denies you coverage. So if you live in Pennsylvania and you bought a plan, let's say in Alabama, and that's where the company is home domiciled, we could not argue being denied coverage of some benefit later on down the road. So you'd have to approach it a different way. The issue really does, I think, come down to this. 40 million Americans, large market for the insurance companies to have. Can you get a public option that's fair, not mandated to be in it, and not subsidized by the U.S. government, but by the co-pays of the premiums? Call it Blue Cross Blue Shield Jr. if you want, but get fair competition once more in the health insurance market industry.
All right. Once again, by the way, you say 40 million Americans. People would dispute that figure, whether they're all Americans, but we're not going to argue about little points like that on a day like today, on Columbus Day, when we're all celebrating. And Congressman, we are so grateful to see you again. Thank you very much for being here.
Thank you, Representative.
Thanks for having me, both of you.
Appreciate it. Well, the Dow losing a little steam